Hi everyone, my name's Trisha and I'm one of the fourth year medical students at the University of Nottingham. So I'm doing my presentation on the patient journey in private healthcare. Just as a little introduction, I'm one of the SSM students doing the private healthcare module, and this was based at Nuffield Health Derby Hospital. The aim of this module was to learn about the structure, organisation, and delivery of private healthcare services in a country where the healthcare system is predominantly state-driven. So, in my timetable, it involved me sitting in on many of Mr. Abdul's clinics and theatres, as well as interacting with various departments that help to run Nuffield. So, I sat in with bookings and inquiries teams, the marketing team, catering team, the PA to the hospital director, the finance team, and also pre-op assessment. So, my experience with all these departments have given me a great understanding of how the patient journey actually works in private healthcare, and that's what I've done my presentation on, but I thought we'd start off with a quiz. So these quizzes are based on statistics that I've learned over the course of the module. So what percentage of the UK population is estimated to have private healthcare insurance in 2023? So this is 10%. What is the average cost of a private GP appointment in the UK in 2024? This is £75 to £100. How much does a private hip replacement typically cost in the UK in 2024? This is £10,000 to £15,000. And which of the following treatments out of the following options is commonly sought privately due to long NHS wait times? This is a hip replacement, so elective surgeries like hip and knee replacements often have long NHS wait times, therefore they're commonly sought privately. Now getting into the patient journey. So the patient's first contact with Nuffield Health would be booking. So they might make an inquiry on the website, and then the bookings team or the inquiry team will reach out to them to discuss further details. I've learnt that at Nuffield, all patients need to have a GP referral to see a consultant. Some other private hospitals might offer the patient to see a consultant without referral. However, having that GP referral ensures that the patient is seeing the correct specialist. So the initial consultation and plan. So this is as we typically expect, where the consultant will see the patient for the first time and collect a thorough medical history, as well as carry out any relevant examinations. This is also the point where the consultant would order any potential diagnostic tests or scans. And I've noticed in private healthcare that there's a much quicker access to imaging, and this significantly reduces wait times. So the consultant will then review the results with the patient, providing a clear diagnosis, and will lay out all the available treatment options. If surgery or an intervention is required, it will be scheduled quickly. And the difference is in private healthcare that the patient will have the flexibility to choose the date for their procedure. And they'll also have the reassurance that the consultant they're seeing will be the one to carry out the procedure. The pre-op assessment. So I spent a day with the pre-op assessment team, and I learned that their role is to ensure that the patient is medically prepared for surgery. They carry out a thorough questionnaire with the patient, and then this optimizes health and minimizes risks, especially risks associated with anesthesia and the procedure itself. The pre-op assessment occurs in two stages. The first stage is taking a full set of observations. This includes calculating the BMI, the blood pressure, and taking an ECG as well. The second stage is a thorough medical history. So this was that really long questionnaire, and this takes place on a one-to-one basis with a nurse. And it also is an opportunity for the patient to ask any questions about what will happen on the day. And this is also where they get explained to exactly what they can expect before the procedure, and what to expect after as well. And the next stage for the patient would be to actually undergo the surgery. So I've split this section up into the anaesthetics part and then also the actual procedure. So speaking to the anaesthetist in the theatre, I've learned a lot about what their role entails in terms of the pre-op considerations, intraoperative, and then post-op as well. Before a patient actually comes in to the theatre, the anaesthetist has to ensure that they're fit for general anaesthesia. They need to also take a thorough drug history and find out any allergies, and this is important in terms of planning post-op pain relief. In terms of the intraoperative management of the patient, the anaesthetist needs to intubate them, and they also need to ensure that the muscles are sufficiently relaxed, as this is really important due to the CO2 insufflation during laparoscopy. In terms of ventilation considerations, this is also something they need to think about, as pumping in the CO2 is going to increase intra-abdominal pressure. In terms of post-op care, the anaesthetist needs to provide sufficient pain relief and also any antiemetics to prevent nausea and vomiting. So the procedure I saw the most of during my time was laparoscopic hysterectomies carried out by Mr. Abdul. I've seen several of these, and I have a pretty confident idea as to what the steps actually entail. So just to summarize briefly what the stages are, the first step is to make small incisions in the abdomen, usually one just under the umbilicus and then two on either side lower down on the abdomen. And these form the ports where the surgeon can insert the laparoscope and any tools needed for the surgery. CO2 gas is then pumped into the abdomen, and then the uterus would be separated from the ovaries, or with or without the ovaries, using a device called the harmonic. So this is a tool that cuts and cauterizes tissue simultaneously, and the uterus with the cervix is then removed through the vagina. So I've learned that different surgeons have different tools that they prefer, but the harmonic was the tool that I saw the most of. The incisions are then closed using minimal sutures and also skin glue, and then this acts as a waterproof dressing as well. In terms of post-op care and recovery, this is the next stage for the patient, and this is where the inpatient nursing teams play a huge role. In private healthcare, I noticed that there's enhanced post-op patient experience due to the private rooms with ensuite. They've got much more personalised care and a more fresh and varied menu to choose from, as I was shown by the catering team. So in terms of my reflections on this module, I was really impressed by how streamlined the process is in private healthcare, right from the outpatient booking to scheduling in the surgery, choosing consultants, and actually going through the surgery itself. The whole process was really smooth and really efficient. And it also ensured much shorter wait times compared to the NHS. And then this obviously meant we had great patient feedback and great patient satisfaction as well. It was really interesting for me to see the multidisciplinary team collaboration. This is quite different to NHS, as I saw more interaction between admin teams and clinical teams, and then this again delivered the streamlined process for the patient. What surprised me the most was seeing how private healthcare operates as both a medical service and a business. So I got to see how factors such as affordability, insurance approvals, and financial viability influence the decision-making of patients. And this is something that hadn't been considered in an NHS setting. So I found that particularly interesting. So overall, I had a really great 4 weeks at Nuffield Health Derby with Mr. Abdul. So yeah, I'm really grateful for this experience. It's definitely something different I've never seen before. And yeah, thank you so much for listening. If you've got any questions at all, I'd be happy to answer them. My email is on the first slide of this PowerPoint. But yeah, thank you so much.